Nadine had not slept a full night in months, lying in the dark, wide, mind racing, and watching the clock roll past 2 in the morning, waking up anxious and exhausted, and dragging through her day. So when she finally met with a doctor, she was ready for the usual anxiety pill. Instead, he reached for something that works nothing like the others. It does not top off your serotonin, but rather it flips a switch in your brain. And the very switch that finally let Nadine sleep is the one most people quietly quit over. If you're currently on Remeron, Mirtazapine, or considering taking it, you need to watch this because I'm going to hand you the information you need in advance. First, the thing nobody said to Nadine. You're not weak because your anxiety stole your sleep and your appetite. You're not broken because a pill got handed to you. When your nervous system has been stuck in threat mode for months, your body stops doing the simple things like resting and eating the way it used to. That is biology, not a character flaw. And there was a real reason a doctor reached for this particular drug. Let me show you what it does. I'm Dr. Er, quadruple board certified psychiatrist. I've treated thousands of people with anxiety, and Remeron is one of the most misunderstood medications I explain. Here is the first thing that sets it apart. Most anxiety and depression medicines are SSRIs. They block reuptake, which is a fancy way of saying they leave more serotonin floating around in your brain. Remeron does not do that. It barely touches reuptake at all. It blocks receptors instead. And that was the whole point. In the 1980s, chemists at a Dutch company called Organon took an older antidepressant and redesigned it on purpose to sidestep the sexual and stomach side effects of the SSRIs. It reached the United States in the mid-1990s under the name Remeron. It was built to be different. Here's how. It blocks a receptor called alpha-2, which increases both norepinephrine and serotonin in your brain's alertness and mood chemicals. And it strongly blocks histamine, the same signal an allergy pill like Benadryl shuts down. That histamine block is the switch. It is why Remeron can make you sleepy and hungry. And that's why it's chosen for people like Nadine. If your anxiety shows up as a racing mind at night, no appetite, and a body that will not power down, then a medicine that hands sleep and hunger back can look like the perfect match. So here's the honest version of when it fits. Poor sleep, low appetite, an anxious brain that will not shut off at night. Mirtazapine is approved for treating depression, but is commonly used for anxiety off-label for these reasons. But here's where it gets strange. That same histamine switch, working with a serotonin receptor called 5-HT2C, does not only bring sleep, it turns your appetite up. For many people, cravings hit fast, and this shows on the scale. Weight gain and a bigger appetite show up in roughly 1 in 5 patients, and they are among the top reasons people quietly stop. Nadine slept better within a week. Then 2 months in, her genes stopped fitting, which she found distressing. I'm not stating the weight gain issues to scare you off this medication. I'm talking about it because a good decision needs the full picture, and this part gets left out. And here's the deeper thing to consider. Remeron can quiet the alarm. It cannot retrain the nervous system that keeps setting off the alarm. That deeper work, calming an overloaded system at the roots, is what I built the nervous system reset for, and the link is in the description below. Now, this is the part that surprises my patients the most. With almost every medicine you've taken, more is stronger. Remeron can flip that on its head. At lower doses, sleepiness tends to be more pronounced. As the dose climbs, it can ease off. That sounds backward until you see the mechanism. At low amounts, the antihistamine effect runs the whole show, and that is mostly sedation, making you feel sleepy. As the dose rises, the drug awakens your norepinephrine system, and that push toward alertness partly counteracts the drowsiness. I want to be careful here because the internet presents this as a hard law. The pattern is real, but the evidence is not fully settled, and the exact tipping point is not pinned down. So this is a conversation for you and your prescriber, never a change you make alone. Now, this next part matters most if you drive or start work early. Remeron is long-acting. It lingers far longer than a single night of sleep, with a half-life of about 20 to 40 hours. So the sedation could linger after you wake up in the morning. In clinical trials, daytime drowsiness turned up in as many as 54 out of 100 people, and it can dull your focus and slow your reaction time the next morning. The next day hangover is worth knowing about. Now, here's the honest catch, and it is a good one. In the biggest comparison, we have a 2018 study in The Lancet that stacked 21 antidepressants across more than 500 trials and over 100,000 people. Remeron landed very near the top, second in fact, behind only an older drug called amitriptyline. That sounds like a slam dunk, but hear me out. The main scorecard those studies lean on, the Hamilton Depression Rating Scale, assigns points for improved sleep and improved eating. And Remeron fixes sleep and appetite fast. So part of that high ranking may be the drug scoring well on the very things this video is about. It is clearly effective, and the number is partly measuring the sleep and appetite fix. In that same study, when a different rating scale focused on core depression and anxiety was used, Mirtazapine never outperformed SSRIs, and at the end point, SSRIs actually showed a non-significant trend towards superiority. Acceptability was a different story. While mirtazapine ranked high for efficacy, amitriptyline was among the drugs with the highest dropout rates. The drugs that balanced both efficacy and acceptability best were escitalopram and sertraline. Here's one more thing, because psychiatry has a history with this drug. Years back, doctors got so excited about pairing Remeron with another antidepressant that the famous psychiatrist Stephen Stahl nicknamed the combo California Rocket Fuel. It sounded unstoppable. Then the bigger trials came in and the magic mostly fizzled. For most people, it was no better than simpler options. So yes, this drug helps a lot of people sleep and feel human again. And yes, it frustrates others with weight and grogginess. One very important caveat: do not stop Remeron suddenly, because your brain adapted to that histamine block. Pulling it away overnight can hit you with rebound insomnia and rebound anxiety, sometimes worse than where you began. This is not a reason to fear the drug. It is a reason to come off it slowly, and only with a prescriber who knows your history. For some of you, Remeron is the right tool for right now. You may need it for a season while your body finds its footing, and that is not a failure. A cast is not a failure because the bone needed help to heal. It is important to remember that you're not just someone who's anxious and cannot sleep. You're someone whose alarm system has been stuck in the on position for far too long. The medicine can turn that alarm down, and underneath it, the system that keeps sounding the alarm can be retrained. That is the part that lasts. Nadine did finally sleep. But the thing that changed her life was not the pill. It was the moment she stopped asking only how to shut this alarm off and started asking why her body keeps deciding night after night that it is not safe to rest. Because a pill can quiet the alarm, but it cannot tell you why the alarm keeps sounding. The root causes of your anxiety, depression, and sleep issues: inflammation, gut health, mitochondrial dysfunction, blood sugar dysregulation, and hormones. This is what this next video talks about.